All right, let's talk about something that a ton of people deal with, losing a tooth. And today, we are going to break down what is really the gold standard for replacing it, the dental implant. Let's get right into it. So, you've got a gap in your smile? Maybe it's from an accident years ago, or maybe a root canal finally gave up. You know you want something fixed, something permanent. But what are the options? For the longest time, there was really only one way to do it, but things have changed a lot. And this slide really shows the two completely different philosophies at play. You see, on the left, you've got the traditional bridge. And to replace that one missing tooth, you actually have to cut down two perfectly good, healthy teeth next to it. Think about that. But on the right, you have the dental implant. It's what we call a conservative treatment. It stands all on its own, right in the jawbone, and leaves your other healthy teeth completely alone. It's just a smarter way to solve the problem. But you know, getting that perfect, long-lasting result isn't just luck. It all starts way before the actual day of surgery with a super detailed and precise plan. And honestly, you can't say this strongly enough. Trying to place a dental implant without a 3D scan of your jaw, well, it's like a contractor trying to build a house with no blueprint. The risk of hitting a nerve or putting it in the wrong spot is just way too high. Modern implant dentistry absolutely depends on modern technology. It's that simple. So what does this planning phase actually look like? Well, it's really 3 clear steps. First, you have a consultation to make sure you're a good candidate. Then comes the most important part, that 3D scan, which is usually called a CBCT scan. And based on that scan, a totally custom surgical plan is made just for you, mapping out the perfect spot, the perfect angle, and the perfect size for your new implant. You should really think of this 3D scan as a GPS for the surgeon. It literally gives them a roadmap of your jaw, showing them exactly where all the strong, healthy bone is, and just as importantly, where all the things they need to avoid, like major nerves, are. This isn't just some fancy optional thing. It's the #1 safety feature that makes the whole thing predictable. Okay, so the plan is locked in. Let's fast forward to the day of the procedure. Now, once that plan is made, there are generally 2 ways the implant can actually be placed, and the choice really depends on what's going on in your mouth. The 2 main playbooks are called immediate and delayed placement. Immediate is pretty much what it sounds like. The bad tooth comes out, and the brand new implant goes in, all in the same appointment. Easy. Delayed placement, on the other hand, is a 2-act play. First, the tooth is removed. Then, we let everything heal up for a few months before going back in to place the implant. So you're probably asking, well, why not just do immediate placement every time? And that's a great question. When the conditions are just right, no big infection, plenty of healthy bone, immediate placement is almost always the way to go. It's 1 surgery, 1 healing period, plus you get to take advantage of the body's incredible natural healing towers in that fresh socket, and the whole process is just way, way faster from start to finish. And this brings us to the coolest part of this whole thing. It's the science behind why implants are so unbelievably successful. This isn't just about screwing something into bone. It's a real, living biological process that makes the implant literally become a part of you. The process has a big name: osseointegration. I know, it's a mouthful, but the concept is amazing. Titanium, the material implants are made of, has this unique ability where your own bone cells see it, grow right onto it, and fuse with it. The implant gets locked into place by your own living bone, becoming just as strong as a natural tooth root. It's incredible. So let's walk through what that healing timeline looks like. Right away, a blood clot forms, which is basically the scaffolding for all the new bone. Then, for about the first month, it's a strict do not disturb phase. That's when your body is sending in all the cleanup crews and the first construction cells. Between 1 and 3 months, new bone really starts to weave into the implant surface, grabbing onto it and building strength. And then, from about 3 to 6 months, that foundation gets rock solid. Now here's a fascinating little detail you might not expect. At about the 1-month mark, the implant is actually at its weakest. Yeah, its weakest. The initial tightness from when it was first placed has eased up a bit, but the new bone growth hasn't fully taken hold yet. This little dip in stability is a totally normal and expected part of the healing process, and it's exactly why your dentist makes sure nothing puts pressure on the implant during this critical time. So, after that whole healing process is finished, and that foundation is totally solid, you finally get to the most exciting part of the whole journey. This is the moment the implant officially becomes a tooth. A beautiful, custom-made crown is attached right on top. It's designed to match your other teeth perfectly, so it looks and feels completely natural. You can smile, you can chew, you can speak with total and complete confidence again. And the results? They really do speak for themselves. With the technology, the materials, and especially that crucial 3D planning we talked about, dental implants have a proven success rate of over 95%. That makes them one of the most reliable and predictable procedures in all of medicine. Seriously. So let's just boil this all down. What's the bottom line for you? It's that a dental implant is a true restoration. It's conservative because it saves your other healthy teeth from being damaged. It's scientifically proven because it works with your body's own amazing biology. And maybe most important of all, it's a true long-term investment in your health, designed to last for years and years, very often for a lifetime. So when you look at all the science, the incredible safety record, and the long-term results, it really becomes clear. The real question isn't just about filling a space. It's about choosing a solution that was literally designed from the ground up to become a permanent part of you.